Making the right career decision can have long-lasting and often lifelong effects. That's why UC Merced students who are serious about pursuing a career in the healthcare industry are taking their passion one step further.
I started volunteering at Mercy Medical Center January 2009. I chose to be a volunteer because I knew that I was interested in a medical career and I wanted to get some hands-on experience and shadow some medical professionals and see if it was really a fit for me.
The Emergency Department Volunteer Program was conceived not as a follow the doctor, follow the nurse program. It was conceived as, you think you want to be a health professional? Well, let's have you come in and really spend some time with people who are ill and make sure that that's what you want.
I'm part of a pre-health based fraternity at UC Merced, and over my freshman and sophomore year, I heard stories from them about how they were given the chance to help people here in Merced at Mercy Medical, and those stories inspired me to become a volunteer.
We have training programs here for many other academic institutions, including UC Davis, our family practice residency program. Merced College has a nursing student program, respiratory therapy program, and so we wanted to connect with UC Merced in some way, so our emergency department seemed like a great place.
UC Merced student volunteers have become an integral part of the emergency department. Volunteers comfort patients and their families and provide them information while freeing up medical staff to tend to patients with the most serious needs.
If we're with a more critical patient or someone who's a little more time intensive, they can be checking on your other patients and kind of give you feedback as to how they're doing or if they need anything. So that's very helpful. If you can't get to a call light in time, they're always there to assist you with that.
During a typical 3-hour shift, student volunteers are behind the scenes, changing bedding and sterilizing rooms, stocking shelves, and taking care of the needs of patients and their families.
Throughout my shift, the nurses and the ER techs can call for me to help them bring supplies to the rooms if they're doing procedures, clean the rooms after patients are discharged. When patients are discharged, sometimes I help them out to their car if they need assistance. Basic interaction with the patients to make sure that they feel comfortable, they feel informed about what's going on with their procedures and their status at the hospital.
While the Mercy Medical Center volunteer program is not a clinical experience, it will help students figure out if they want to pursue a career working with people with health issues.
One of the angles of the volunteer program is bridging that gap between what you're learning in academia, textbooks, and professors teaching you, to coming here where you have X illness and you're taking care of these problems and how you're doing with that, the science behind what you're doing and what you're applying and what you've learned with how it unfolds right in front of you.
We had a bus crash recently with 20 small children, and the volunteers were right there. What can we do? How can we help? They got us chairs to serve the parents and the children. They got popsicles for the kids. They kept the kids entertained and comfortable while they waited here in the emergency room, which can be scary for little kids. It's nice to have the students there when the nurses can't be there at their side to kind of comfort them and let them know that we're there for them.
The volunteer experience is preparing UC Merced students for promising careers in the healthcare industry.
After graduation, I hope to join a nursing program and pursue my Bachelor's of Science in Nursing or possibly my Master's in Nursing and become a labor and delivery nurse.
Through this experience in the ED, I've been able to gain skills of understanding patients first before understanding how they should or could be helped. I believe that having those skills will help me become a better practicing physician in the future.
I'm really happy that I started volunteering, and it's really reassured that being a nurse is what I want to do.